The following is for informational purposes only. For medical advice, please see a medical professional.
Welcome to Staying Alive with Margaret and Susy. Today we are talking about cognition and aging. And I'm going to start it off. I have more stories to tell on this issue, as you will soon hear. And then Susy's going to handle all the lifestyle factors which can be used to prevent and reverse some of these issues. So welcome. Hi, Susy.
Hi,
Um,
Margaret.
I am taking the lead on this one, and I call this episode Cognition and Aging as opposed to cognitive decline with aging, because it turns out not everybody has cognitive decline with aging, and there's so much inconclusive numbers out there about how many people do have cognitive decline as we're aging. I In doing the research, I've seen a third, a half, two-thirds, maybe everybody, maybe not, and so it turns out it's this very subjective thing that we have to help assess with our doctors, like a lot of these other medical conditions we've been talking about. And so I'm going to talk you through that, and Susie's going to help with all the lifestyle stuff. So, is cognitive decline a normal part of aging, or is it preventable? Some
Good
say
question.
yes, some say no. And what we found out when we did the research is a lot of it can be reversed, 45%. So we're going to come back to that when Susie describes the lifestyle issues. And then what is the difference? We were set to find out and hoping we could really clearly define what's the difference between cognitive decline, dementia, and Alzheimer's. These are really important questions for aging people and especially our families. So we wanted to do this episode, and we've had personal experiences with it with aging family members, which you're going to hear about. And then some of our friends are in this right now with their spouses because we're in that age group. And so we did a little bit of interviewing a couple of people, and we did our research. And what we found out is that this is an area of medicine with some vagueness and some disagreement without exact definitions, and it's somewhat subjective in the diagnosis. So it's really important for our doctors to get to hear directly from us on what's going on with our aging brains, because that's the best way they can assess what's going on versus a spouse who might be overreacting or something. And there's social stigma and there's fear. And so it turns out doctors are not easily inclined to even use the word dementia with their patients. And there's not consensus on how dementia is defined. And so in researching the difference between what's called cognitive impairment, dementia, and Alzheimer's, what we found out is that all patients diagnosed with the most severe form of dementia, which is called Alzheimer's, have a biomarker for the disease. That's one way it's diagnosed. It's not uncommon for families who have a family history of Alzheimer's to get tested for that biomarker. And guess what? It turns out that 30% of us with the Alzheimer's biomarker never get dementia. And there's some data that a small percentage of people with no biomarker do get Alzheimer's. And I have a theory on that, that it's just different doctors use different criteria to make the diagnosis. But
Yeah.
the number of people over 65 years of age with Alzheimer's is less than 5%. And doctors almost always use the biomarker with the other symptoms to define that. And then if folks live decades with Alzheimer's, we find that the rate of Alzheimer's goes up in each decade of life. In other words, people in their 70s, 15% might be diagnosed with Alzheimer's.
Now, Margaret, are you talking about people with the biomarkers or?
With Alzheimer's.
Okay.
As I just said, 1/3 of the people with the biomarkers never have any symptoms. So these are only the people with Alzheimer's, which is less than 5% of the population. Then in the 70s, it might be 10%, and
I see what you're saying.
80s
Okay.
or 90s, it might be 15%
I
of the
see.
population.
Okay. So the older you get, if you have a biomarker, it might be a little bit more common. Yeah.
Yes.
Yeah.
And the healthy lifestyle factors may help change that. I haven't seen the studies on it, but I would venture to guess the people with the healthiest lifestyles, with the biomarkers who do get it, they're able to stave it off into their 80s or 90s. And whereas
in most cases, I think
people who have really lifestyles that we might not like to see, they're more likely to get it in the younger years. So it appears that the criteria for dementia diagnosis is not clear-cut, and some doctors differentiate cognition changes differently. Some doctors call it Alzheimer's if you have symptoms plus the biomarker. And they call it dementia if you have symptoms and there was damage to your brain due to trauma or disease.
So what happens if you don't?
Otherwise,
I'm sorry, but what happens if you are presenting symptoms but they don't know what's going on with your brain?
Then they call it a normal part of aging called cognitive impairment,
No,
which can be mild, moderate, or severe.
Okay.
Now, on the other hand, some doctors use the severity of impairment for the diagnosis. Mild impairment, many doctors don't want to call it dementia. They call it MCI, standing for mild cognitive impairment. If you're moderately impaired, then some doctors call that dementia, even if it's a part of aging and there's no reason to think that there's trauma or disease to the brain. If your impairment is very, very severe, some doctors might call that Alzheimer's, even if there's no biomarker, but many doctors would never call it Alzheimer's without the biomarker. So you can see how it's a tricky thing. So, and we're not doctors, and we're not going to dispute doctors or say who we think is wrong or right. But what we can do as health educators and nutritionists is tell you that it turns out that 45% of all dementia is preventable, and 1/2 of the people aging who are found to have mild cognitive impairment also have treatable diseases that once treated, the cognitive impairment goes away.
Right.
So
if they can be treated to the point where it's actually cured, right?
If it can be treated. The most common one, I'll tell you the most common one, urinary tract infection.
Oh, yes.
When an aging person has a UTI, cognitive impairment is the first symptom, because for some reason as we age, we don't feel it the same way. And I had an 80-some-year-old friend who was like perfectly with it, and she was still driving. She got lost coming home from the grocery store, and like, what is going on? She went to the doctor. Turned out she had a UTI, went on antibiotics. A week later, no cognitive impairment.
Yeah, that happened with my mother. It's definitely a thing that people need to be aware of, especially if you're dealing with an older person.
So, right now, let's focus on the healthy lifestyle factors to
Mhm.
help prevent or treat other illnesses that might reverse impairment.
Yeah.
So,
Yeah.
we're going to have Susie talk about that now, and
Yeah.
maybe I'll throw in a few things.
Yeah.
So,
My mother had vascular dementia, and it definitely was related to other vascular problems that she had throughout her body because had several stents in her heart and her kidneys. And so she had major vascular damage going on. So when she got dementia, it was diagnosed as vascular dementia. Now, in her case, the lifestyle factors that could have reversed that needed to happen years before.
right. So
Yeah,
that would
because
not
she
be a
was,
case of
that is not a
someone that
case.
was
Yeah,
treatable illness that could
right.
reverse it. So at
Right. It's
that
not
point,
reversible. Now,
unfortunately, we want to help you guys before it gets to that
right,
point.
right.
Yeah.
Hers was related to smoking mostly. So, yeah, but yeah, there's definitely a lot of healthy lifestyle things that people can do. Um, Basically, a heart healthy diet is a brain healthy diet. It can be called the mind diet. And it can, it revolves around mostly a plant-based diet, fruits, vegetables, whole grains, healthy things like fish, lean meats, healthy oils, healthy fats in your diet, a lot of omega-3 fatty acids that come from fish and from nuts. It's not just food, though. I want to, emphasize that exercise plays a huge role in
Right.
prevention of all kinds of things going on with the brain.
Getting the blood flowing, that is
Mm-hmm.
key.
Yep. They
Mhm.
recommend about 150 minutes a week of some kind of aerobic exercise.
Mhm.
If you put that out, that's, a little more than 20 minutes a day.
Yeah.
Yeah. So
Doable.
it's doable. And, there's a lot of different types of exercise. And it doesn't necessarily, if you can't really walk a lot, there's chair yoga, there's stationary bikes, there's swimming. There's a lot of things that you can do. There's also sleep becomes a really important factor, especially as we age. A lot of people have problems with sleep. I think we could do a whole episode on sleep. Um, I think, sleep it's normal for people to not sleep that well. Sometimes throughout history, people have not slept that well. I think it's a pretty normal thing. But if you're really having trouble with sleep, talk to your doctor. I don't recommend taking medications for it necessarily, but changing some of your habits that may be interfering with sleep.
Mhm.
For instance, alcohol. Alcohol interferes with sleep. People think, I'll have, my grandfather did this, a little wine before bed, it definitely interferes with sleep patterns. Yeah.
And alcohol
And
definitely affects dementia
and alcohol
depression.
definitely affects your risk of getting dementia.
Uh-huh.
Definitely. The other thing that's interesting about increasing your risk for dementia is hearing loss.
That's true. That's a good point.
And, if you think about it, if you stop hearing things, pretty soon your brain stops remembering how to hear those particular sounds. And they say if you don't get your hearing loss treated, that you will probably never regain those sounds again. So it's super, super important.
Interesting.
I think handling stress, figuring out what works for you to handle stress. Remember, stress is a normal part of life, but it's how we deal with it that matters. So figure out ways for yourself to de-stress.
Yeah.
I don't mean looking for cookies every time you get stressed out.
And I've noticed that people who one thing that happens with aging is, and I don't know anybody who this hasn't happened to, a little bit of short-term memory loss.
Yeah.
And what I've noticed is that with that, if I'm stressed, my short-term memory problems are more.
Yep.
If I'm stressed, and if
Yeah.
I'm relaxed, not so.
Sure. And a lot of it is focus. There's some studies out there that show that sometimes people who even have dementia can rally in certain situations. But if you think about it, it's that social stimulation. It's getting out of your normal, boring routine and doing something a little more interesting, which is why they encourage people to learn new things as they get older. Maybe, even if it means just doing a crossword puzzle, but learning a new skill. Maybe learning to play a musical instrument or learning
Yeah.
to use another tool or learning painting or drawing or sculpture, whatever it is. But it really, because what it does is, there's this thing called pruning that happens in the brain once you get to be a teenager. Unfortunately, all those neurons are forming until you're a teenager, right? Well, once you get to be a teenager, which is why you should take care of your brain when you're a teenager, it starts pruning away some of those neurons that you gained when you're in your early childhood. But there's evidence that shows you can still increase those neuron connections with some of these lifestyle things. And social things are super important for the same reason. Being around other people. I've really noticed that I appreciate being around other people my age because we're all kind of going through the same thing.
Yeah.
And, and we can kind of laugh about things that we forget. I mean, the
Right.
other day, I forgot the password for my laptop.
Yeah.
And I had to go to the Apple store and get it fixed. I mean, things like that happen. For the life of you, you can't remember.
Right. One of my friends joked, hey, it's normal aging if you forgot where you parked your car in the parking lot, but if you forgot you drove your car, then you better talk to the doctor.
Or this was a good one the other day. I was talking to my sister and I said, we're doing another episode. What is it on? I can't remember.
Yeah,
it was on dementia. So it's really important. Dan, and real briefly, I wanted to say there are some tests that you can get done too that can impact cognition. One is
I'm going to definitely talk about my testing. Yeah.
Yeah, but B12.
I see. Testing
those kind of things. Yeah.
For nutritional.
When you go in for your regular blood work, you should really ask your doctor to check your B12 levels because that can affect cognition. I noticed that my husband was a little spacey at one point a few years ago. Sure enough, we went to the doctor. His B12 was really low and he got shots and it really, really improved. The other one is vitamin D.
Yeah.
It's very typical for people to be low in vitamin D, no matter how much sunshine you get.
Yeah.
Because we don't live in the tropics and most of us don't live in the tropics anyway. And so have your vitamin D checked and make sure your levels are up to normal because they can be low and that can affect your brain as well.
And don't forget dehydration. Dehydration causes cognitive. So
that's
if you got your electrolytes checked, that might be useful.
Sure. Electrolytes. Your electrolytes should be in balance if you're not dehydrated. Yes.
Right.
And the other ones, we did an episode earlier, it was episode number 7 on the gut-brain connection. And that's all about having a healthy gut and eating, good amount of fiber, getting probiotics in your diet. So if you want more information about that, check out that gut-brain connection, episode number 7.
It turns out that the healthy lifestyle things for aging are
really
also
matter.
the same ones for cognition, basically.
Yeah, they really, really matter.
Yeah. Well,
anyway,
should I move on? Anything else you want to say?
If I think of something, I'll bring it up.
Okay. So lastly, what I wanted to talk about is what if you've done all these healthy lifestyle improvements possible that Susy just mentioned, and what if you go to the doctor regularly and you have no untreated medical conditions and you still believe, I think I'm having cognitive decline. It's always best to see your doctor. It's best to own it, talk about it, and absolutely don't ignore it or deny it in any way, because cognitive changes may be the most important place to advocate for oneself, because as we've told you, it's so subjective. Our doctors need our feedback to help them assess our conditions. And hearing it secondhand from our family members or friends, and we're not even able to talk about it at that point, it makes it so much harder for all concerned. It's harder for the doctors to diagnose. It's harder for the family members to get the help needed for the patient. And so I want to finish the episode dispelling any fears around this by telling you my personal experience, because guess what? You are looking at somebody who's been diagnosed with mild cognitive impairment. because 1 year ago I got my diagnosis. And as you can see by this episode and hopefully others that you've watched, my brain seems to be functioning pretty well. And you might never have any way of knowing that I have mild cognitive impairment without me willing to be honest and tell you about it. And what happened to me was it hasn't been a gradual thing with aging. For me, what happened was, although I will say dementia seems to run in my family or cognitive impairment, and so we have all had the test for the biomarker, and not my father, whose side of the family has dementia, nor any of us, well, not me, have the biomarker. Any of us have been tested, have the biomarker. So, I mean, and I know from the lifestyle issues in my family that there are other things like the vascular dementia that Susy mentioned with her mom that are the cause in my family, likely. But in my case, mine was not to do with lifestyle. It was not slow onset. It was sudden and it was much more obvious. And so what happened was in 2023, I had heart surgery, and unfortunately, there were complications. And so, without going into the complications of the surgery, it was a near fatal experience for me that I made it through. But one of the ways that they helped me get through it was that I had to be kept on anesthesia for 24 hours. And so when I came out of it, obviously I sort of had like PTSD. I was extremely stressed out about the whole thing. And and I could sort of sense that some things were different, but I had no way of knowing, is this just psychological? Do I just need to get all my healthy lifestyle stuff in check, and will it go away? And like we also know with major surgery with aging people, that anesthesia does affect the brain, but they know enough now about anesthesia that it tends to reverse itself at most within a few months. And so I waited a whole year to see if mine went away because I knew how serious my surgery was. And what I noticed was that there was no change in my problem solving ability, my language skills, my complex reasoning. My short-term memory seemed to be up and down based on the lifestyle factors that we just mentioned. It didn't seem to be that much different than other people my age. But what was definitely permanently different was what they call my visual spatial ability. And what I call it, this is my layman's terms, and it's not what any doctor would call it, is like suddenly for the first time in my life, I had dyslexia. And what that looked like was I take my t-shirt out in the morning and I look to see where the tag was, and I put it on and I got the tag in front. Or I'm walking around in the day and my shirt's inside out and it takes me hours before I notice it. Or when I parallel park a car, what I used to be like, that was like I was number one at. I was so good. Sometimes I would tell my husband to get out from behind the wheel so I could park the car. Well, what I used to be able to do one time now would take six times. And the oddest one was I parked in in a dark underground parking lot that was very crowded. And when I looked in the rearview mirror to see where the other vehicles were parked behind me, what I saw in the rearview mirror was a car on the opposite side of where it really was when I turned around and looked. So it was like it created a mirror imaging situation. So I knew what was going on with me was not something normal. And I told my spouse about it. And because I seemed normal in all other ways, he thought I was just like stress and me not focusing in well enough, and that it seemed to him that it seemed psychological because my surgery was so traumatic. It seemed to him that after a year, it might take years to recover psychologically from the trauma, because he was pretty traumatic going through it as my spouse. It was pretty traumatic for him. So, so I knew I needed to talk to my doctor about it and get an actual diagnosis. And a lot of times that's where family members end up, whether it's the patient themselves admitting to it or their family members noticing it. They need to talk to their doctor. And it was interesting because my doctor, she thought I seemed so with it compared to any patient she'd ever had with cognitive issues. I think she sort of was maybe thinking the same thing as my husband, but she said, "But if you want to, we can do a cognitive test." And I was like, "Yes, please." So the cognitive test, without going into details, there's several different components to it, and they will even like have you do like a certain thing, like touch your finger to your nose, like they would do in a drunk driving test. And so um, I I was thinking, gosh, maybe I passed everything in this test. Like I think I did pretty well, and then it turned out that in that area of visual spatial ability, where it was a test where they had you match an image, but the image was of the same thing, but it was a different size. And so you had to
Oh,
be able to pick
interesting.
it out, and they measured how quickly you could pick it out.
Hmm.
In that area,
Blue
I
flags.
scored out of 100% for perfects, the highest score of any 71-year-old taking the test. I scored 4%.
Wow.
And my doctor said to me, "Well, looks like something happened here." Like like she
Yeah.
now believed me that, well, yeah, she said, "Okay, so yeah, so something happened during the surgery. There is a change here, but the good news is that yours is not from disease. It's not from lifestyle.
Hmm.
It's not something that we would expect to progress. We
Well,
would
that's
expect
good.
it to just be at this level. Um, if you really want to track over your life, if it's progressing or not, I'd be willing to do an MRI on you, every
Hmm.
year
Hmm.
if you want, if you really, but like the reality is, Margaret, it just kind of is what it is,
Wow,
basically. She
that's
said
really
to me,
interesting.
and it's at the point that it's at, and she's like, "Do you want an MRI?" Like she said, to be honest, it's like, what's it
Yeah,
going to
what would it
tell
do?
us? It is what it is.
Yeah,
We
yeah,
know what caused yours, and you've already had so much medical testing because of your heart condition. Like, do you really want
yeah,
another MRI? And it's like,
yeah, yeah.
no,
I
no,
know what
no,
you
no,
mean.
no,
Yeah,
no. Let's just
yeah. Well,
leave it
you're
alone.
in a way you're fortunate because
Absolutely.
it's those things that were impacted and not others. You think about people, well, I hate to say it, football players who get multiple concussions
Right.
and end up with dementia.
Right.
I myself have had,
Yeah.
concussions, and it's
So
scary, because things can happen that can permanently change things.
So those are the ways that people can have traumatic brain injuries at younger
Yeah,
ages. But
yeah,
I feel like this provides for me an opportunity to to be a mentor, shall we say, for those of us who are aging with cognitive changes,
mm-hmm,
because I would want every person listening to this who thinks they might have cognitive decline to do what I did. And like, don't try to diagnose it yourself. Don't keep it
right.
secret. Don't not talk about it. Don't let your uh, husband try to diagnose it who thinks it's all in your head. Go to your doctor, and since it's so subjective, insist that, yes, I do want this or that test, and then it's up to each individual patient how
Right.
far they go with the testing. They're going to start with the uh, cognitive tests, and then they can go on all the way up to
Hmm.
an MRI if you want.
If
And
necessary. Yeah.
right,
Yeah.
and they
Yeah.
can do the biomarker.
Well, I'm so
They can do
glad you
that.
shared that story. I mean, it's really important um, to know that we're not alone. It's so important. And I think it's so important that we talk about this.
Yeah.
People, I think people are embarrassed or they're like, and I think a lot of people, I think about my mother's generation, it was embarrassing to have friends who had dementia because I think people are like, oh, therefore, with the grace of God, go I. I mean, they're worried about themselves having the same issue, and it's important to
Well,
talk about. And we should all support each other and feel free to talk about it.
I don't know what all the social stigma is about. Like, I know in my parents' generation, um, unless it was Alzheimer's with the biomarker, that a lot of times they attributed it to alcohol and alcoholism, to be honest.
Hmm.
And
Yeah,
and so people didn't want to talk about it for
yeah,
fear that, oh, everybody's going to think it's because I drink too much and I'm not going to quit
yeah.
drinking. I mean, I'm sorry, I come from that kind of
Well,
background.
and people want to maintain their independence too. They don't
Mhm.
want to have to give up driving. They don't want to some people don't want to rely on others.
Mhm.
They want to be independent. You're not in your 90s and somebody tells you you should stop driving. Well, first of all, I'm here to say I think that's a good idea, but people don't like it. They really don't.
Well,
Yeah.
uh, we now live in a society where we've seen what bad things can happen where aging people don't take responsibility for their
Yeah.
cognitive decline.
Yeah. And
And
then
it,
they get
it,
in places of power
it
or
does
places of
not
authority. Yeah.
it does not make the world a better
No,
place.
it
It
does
does
not.
not at all.
It
There's
does not.
nothing wrong with us as aging people learning how to connect with younger friends and families
Hmm.
and members and get the help we need.
Right.
And
Right.
it really makes for a much healthier um, end of
Yeah.
life experience
It does.
with
Yeah.
connection with people of all ages.
Yeah.
That's the
Yeah.
way to go.
Yeah.
So I think we're going to end it right there and
Yes. Thank you so
say
much.
thank you so much for listening. And until next time, Susie
We
and I
are
are staying
staying
alive.
alive.
You've been listening to Staying Alive with Margaret and Susy. This show is hosted by Margaret Cooley and Susy Hymas. To subscribe to our show, leave a comment or ask a question, please visit stayingalivewithmargaretandsusy.com. Our podcast is available on all major podcast platforms. If you've enjoyed our program, please feel free to leave us a 5-star review. Thanks for listening.